I think with the increased rate of immunotherapy, a lot of patients received amazing clinical benefit by receiving this kind of treatment. But still, there is a large fraction of patients that do not respond to immunotherapy at all, or they initially respond for then eventually relapse. So I truly believe that the challenge now is to predict which patients are going to receive any benefit from the treatment, to prevent over-treatment and useless side effect, but also to understand the mechanism that leads to immune evasion so that we can overcome this resistance mechanism. Our paper, our main message was the idea was trying to find an autologous system, so a new platform where we could at the same time examine the tumor and the immune cells. So try to study the interaction between these two compartments. What we did was using tumor organoids as tumor source. Tumor organoids are mini organs that kind of very well replicate the tumor that is present in the patient itself. And we use blood as a source of immune cells. So what we did was is to try to train the immune cells present in the blood with the mini tumor organoids that we create in the lab. And in this way, we train the immune cells to recognize and kill the tumor. At the moment, there are several implementation of this possible of this system. So one possible implementation would be to use the T cells that we trained as cells that we can re-inject back to the patient, cells that have been trained to recognize and kill the tumor, and maybe we can put them back into the patient, let them do their own job. Of course, the problem in this case is to try to avoid any risk for the patient, because we are introducing highly active cells in the patient that can be extremely dangerous, that can target something that is not the tumor only, but some other organs present in the patient. So the real challenge now is trying to, first of all, understand the specificity of these T cells, how much are they specific for the tumor only, and not recognizing anything else in the blood or in the body of the patient. It could be a very nice idea, the one of really knowing what the cells is recognizing. So the way it works is that an immune cell has a sort of a receptor on top of its surface, and they recognize something that is extremely complementary. So there is only one antigen, only one molecule that these immune cells can recognize. But it's extremely challenging to identify what is this molecule that is recognized. So I think that may be one of the real incredible challenge we have to address first.